Amy. I'm going to be your nurse today. Washing my hands.
Hi.
Can you please state your name and date of birth?
Yeah, Kristen Webb, 4/11/96.
Great. Can you tell me where you are?
I'm in the doctor's office.
And what month is it?
It's July.
Great. And please squeeze my hand. Perfect. So my patient is awake, alert, and oriented, and on the Glasgow's coma scale, she would be getting a 15. Her eyes were open when I entered the room, and she obeyed to all my commands. Kristen, can you tell me, do you have any allergies?
No allergies.
Do you take any medications?
No medications.
And any history of past surgeries?
I broke my wrist 2 summers ago.
Oh, well, I hope it feels better.
It does, thank you.
And tell me, what brings you in today?
It's my headache. I've been having this same headache for the past 3 days now.
And anything you do make the pain worse or better?
The light makes it a lot worse, so I find a lot of comfort in sleeping and cool ice packs.
And then how long would you say the pain lasts?
The pain probably lasts for the past 3 days consistently.
Oh, okay. And on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced, what would you say your headache's at?
My pain's probably it's really bad, so it's like a 7.
Okay, so we're gonna check that out.
Okay.
First I'm just gonna take your vital signs. So right now I'm just gonna take my patient's pulse, and I'm gonna use that in her radial artery. Okay, so I'm taking her pulse. And my patient's pulse is 65, which is normal. It should be between 60 and 100. And next, right now I'm checking my patient's respiration. So my patient has about 16 respirations per minute, and that's good because it should be between 12 and 20 respirations. And right now I'm gonna check your pulse ox. So can I just have your index finger? And great, 99. That's perfect for oxygen. And I'm gonna take your temperature, so please put this under your tongue. Beep, beep. 98.9, great. Okay, and right now I'm gonna take your blood pressure. So first I'm going to check the patient's pulse, and I'm gonna put it about 3 inches over the brachial artery, and I'm gonna feel until I don't feel pulse. Okay, so her pulse stops around 140, so I'm going to pump it up until about 170. And now I'm pumping it up to 170 and releasing the air. Great. So the first sound I heard was the systolic, and that was around 128, and the second one I heard was the diastolic, and that was 74, so really good. And now I'm going to be assessing your thyroid, so I'm just going to come right behind you, and I'm going to feel your thyroid, palpate it. Great. And Kristen, do you mind just drinking this glass of water? Perfect. And now I'm going to be assessing my patient's cranial nerves. So the first cranial nerve that I'm going to be looking at is the olfactory. And the way I'm going to do that, can you please close one nostril and close your eyes, and I'm going to take this known object and just tell me what it is.
Coffee?
Yeah. And now please do that. Close your other nostril.
Vanilla?
Exactly. And then the next cranial nerve that I'm going to be testing is going to be your cranial nerve 2, and I'm going to be doing that checking your eyesight. So can you just please stand up, and we have the Snellen eye chart up here, and please tell me what is on line 10.
Okay, L, T, S, Q, R, P.
Great. Okay, perfect. So the next cranial nerves I'm going to be testing are cranial nerves 3, 4, and 6. So the way I'm going to be doing this is, you can sit back down. You're going to watch my finger and follow it.
Okay.
So first I'm going to go up. Perfect. And that was the cardinal gazes. And now I'm going to be testing cranial nerve 5. So I want you to clench your teeth, and I'm going to pull down. Great. And the next cranial nerve that I'm going to be testing is cranial nerve 7. So can you please just puff your cheeks up? Great. Smile. Frown. Raise your eyebrows. Perfect. And the next one we're going to be doing is cranial nerve 8. So the way I'm going to do that is, can you just close one of your ears, and I'm going to whisper something in this ear and tell me what I say.
Okay. Chicken nuggets and dogs.
Perfect. And now the next one.
Purple pony sunshine.
Okay, great, Kristen. The next cranial nerves I'm going to test are cranial nerves 9 and 10. So I'm just going to put this in the back of your throat, and she gagged, so that is a normal gag reflex. And the next one I'm going to be testing is your spinal accessory. So can you just shrug your shoulders for me, please? Perfect. The next one I'm going to test is cranial nerve 12. So can you stick out your tongue? Now put it in. And press it against this cheek. Oh, yes, next cheek. Perfect. So now I'm going to be testing your cerebral function. So can you please stand up and put your arms on the side of your legs, feet together, and close your eyes. And I'm just going to make sure I put my hands here so that you don't fall. Perfect, you can open your eyes back up. And now put your arms out, and I want you to touch your nose like this. Great. Okay, you can sit back down now. So now I'm going to be testing my patient's reflexes. So the first one I'm going to be testing is the brachioradius. So I'm going to take the patient's arm, and I'm going to use this hammer to hit her reflex. Perfect. And next I'm going to be doing triceps. So can you please put your arm dead and now put it in an L shape, and I'll take the tendon by the elbow and hit it. Oh, great. Extension of the forearm, that's exactly what we're looking for. And next we're going to be doing biceps, so just keep your arms rested, and then I'm going to just do this right above your elbow. Perfect. And the next we're going to be doing is your patellar, so just relax your legs, and I'm going to be hitting this right below your knee. Oh, amazing! And then then the next one I'm going to be testing is your Achilles. So please go on one knee.
Okay.
And then I'm going to be testing your Achilles. Great. And the last one I'm going to be testing is going to be your plantar reflex. So I'm going to draw a J on the bottom of your foot. Perfect. So a negative sign of this was if she flared her toes, and that would have been a Babinski sign. And now I'm going to be assessing the circulation of her skin. So I'm going to note that her skin looks well perfused, her cheeks are flushed but not too red. I'm gonna palpate her skin. So feeling her arms, they're warm, her face warm, looking at her toes to make sure that we have great blood circulation. They're warm. And then now we're gonna be doing her pulses. So I'm gonna be taking her pulse and I'm gonna do that on her brachial and radial. So you're going to go from the thumb, go down. Great, so I'm going to be giving my patient a 2, which that's a normal pulse. And the next, so that was the brachial, now I'm going to be doing the temporal. So I'm going to be putting it right here. Great, so that's also normal. The next one I'm going to be doing is your carotid. So I'm just going to check right over here. Perfect. I did your radial, I'm going to be doing your brachial. Great. Please uncross your legs.
Oh yeah.
Your popliteal. Posterior tibial. And hitting this to the top of her foot. Great. Okay, and now I'll be assessing my patient's lymph nodes. So we're going to be doing all 13 her lymph nodes. So first I'm going to be doing the front of her ears. Great. Behind the ears. Occipital. Submental. Submandibular. Superficial. Posterior, deep cervical. So please turn your head. Great. Subclavicular and axillary. And my patient had normal lymph nodes, so they were not swollen and they were movable, and you were barely able to feel them. They were not hard. If they were malignant, they would be hard. So they would still be moving.
Mm-hmm.
Yeah. And now we're going to figure out why my patient has a bad headache, so the doctor will be coming in shortly.
Okay, thanks.
No problem.